At the moment, PET-CT is a really major technique that we use in imaging in myeloma, which is a great technique, but it was not developed for myeloma. I think one major thing that we have to improve is the tracers, like the dye that we use for the PET-CT, the nucleoid. We have to have a more specific tracer for multiple myeloma, and I know that colleagues are working on so-called CD38 tracers that are much more specific for myeloma, so we can see more clearly where the disease is in the beginning and also after treatment where we find residual disease. There's also ongoing investigations in functional MRI, magnetic resonance imaging, that give us more information than just morphology, show us perfusion of the tissue, show us cellularity of the tissue, so we can get more information out of imaging that we do right now. And there's a lot of research going on in this area.